inspired neighborhoods. You see our, I'll start that off. This is the organization I work for. I founded that organization. I'm the CEO for that organization. We are a social business, and it means many things to many people. People know it as community businesses, social enterprises, and social business. Hands up, how many people run social business in this room? Okay, we need to increase those numbers, guys. Bradford is the best place to do that. Although Steve painted a bit of a picture for us, we're going to change all that in Bradford. So social business means to us is that this is the organization which works with the communities. It is community-based. We are community-led. And we try to resolve the issues which are arisen in the community with the community, and usually they are in the lead. If going through the organization, they are at all level of our organization. They are in the governance, they are in the management, and they help us delivery of the projects. So you can see there's a thread. We are based in Bradford East, which is BD3, if people know about that. Bradford Moor area. We were born there. We are in Idle at the moment, but we are still in Bradford East. That is our home ground. That's our stomping ground. But we deliver services across the Bradford. The other reason we call ourselves a social business, because we reinvest our resources in the community. So I'm going to tell you 1 minute where we came from and how we grew, which will give you an idea of the projects I'm going to talk to you about later on in a minute. Cameron did say it'll work. Okay, so we are a very young organization, only 7-year-old, but we really got going in 2014. When we started, we only had 1 staff, which was me. Today, we have 57 staff, and we're advertising for another 30, so you can see the growth in that. And it also shows you where we are going. So in about 2024, we should be turning over about £3.5 million. We should have about £10 million of assets, which shows that Bradford is a right place for right people. We couldn't have done it by ourselves. We work with statutory bodies, council, care trust, hospital trust, and so forth. We have community partners who work with us, and without them, we wouldn't be able to do that. So the partnerships in Bradford is really, really great. So if you want to create a social business, this is the place to do that. So the other thing to tell you is that we also have volunteers who help us all the time. So we have about 42 volunteers who work with us at the moment, and the numbers are ever increasing. So how do we make it work? Now, I'll give you an example. This is the area of Swain House. We identified the area because we knew there was a lot of issues in that area. We knew that 1 in 5 people were suffering from diabetes. We knew 1 in 4 was obese. We knew the life expectancy was 10 years less than it would be in affluent area. We knew there was a high rate of coronary disease. We knew there was welfare issues in dependency sense in the area. So, but knowing it and finding out from the community is 2 different things. So we set about a year ago, talking to the communities who live there, to find out what were their real issues. And no surprise, they were no different than what we already knew. But it was an endorsement by the community that is actually what was happening. From that, we also spoke to them about what solutions they will like and how they can help us resolve those issues which exist in the community. We have a very simple principle. and that is we will if you will. So if the communities work with us, we put double the effort they are putting with us. That means they always are contributing to changing their lives. Now, once you find out what they need, you need to get to what they want. And that's the tricky part. So we had a long conversation for more than a year about these are the issues, how are we going to resolve those? So the top of the agenda was that we need to resolve the health issues. We need to resolve the issues which impact our health. And surprise, surprise, we had to go speak to the doctors in the area, GPs. We needed to speak to the pharmacy. We needed to speak to the other health workers. And from them, you find out what are the services which can be brought into the area. Now, if any of you have ever brought number of services in one place and try to make sense that they all deliver what you want them to deliver, that's a big challenge. It takes a long time to sort that out, and everybody has their own priorities. So they told us that they want to resolve health, which means they wanted stuff which is not delivered in doctor's surgeries, and they didn't want it to have the appointments for the mental health or physical health or other interventions during work time necessarily. They wanted in their own terms. They wanted a place where they wanted it delivered and how they wanted it delivered. And that poses other issues. Physical building is an easier bit to do. It's relatively difficult, but somewhat it's easier than to put services together. So we set about first thing to do was to get the physical building sorted out. So we sat down with our communities, designed the community center, and we set about what services will be delivered from there. Now, this center looks quite nice, but when you have a tender bill coming out for £3.5 million to deliver that, you sit back in your chair and you think, how are we going to do that? Obviously, you work with your funders, and one of them is Power to Change, who are in this room for us, and there are a lot more who will be contributing for us to deliver that. There are a lot of partners. We got what was existing on that land from the council, so they were very kind to us. But it's a long chain to bring those changes about. So the lesson there is, how do we engage our communities to understand this? How do we engage our services to understand that we need to deliver the services what are fit for purposes for the community? And you learn many things on the way. You learn that what services are delivered in GP surgeries and how are they delivered, and what roles the health workers play. Do we need district nurse to sit in the school and give little Johnny a bump note every day? Can we use that role differently? So there is a lot of conversations to be had, and the change continues at a very slow pace. We are very lucky that we were able to raise funds to deliver the first phase of that building. We were very lucky that we were able to secure the space and the land, and we are able to work with our GPs to put the services in place which will be delivered from there. So, but the game doesn't stop there, because communities, when you're engaged, they are still working with you and they're developing their ideas constantly. The new ideas are coming forward. There is new ways of doing things which are coming forward. And once we came to the conclusion and said, hey guys, we've had the planning permission, we've secured the money for the first phase, we are raising money for the second one, it'll be ready in about a year or two when construction starts. They'll say, okay, we need this bit more. We can do a little bit more. Why not look at the housing bit? Why not improve? That will improve the quality of our life. That will give us a space for little children to study. That will bring a healthier environment. And we forget, and the other interesting thing we found when we were talking to our GPs, that 70% of the people who were visiting our GPs had other issues than what they were presenting. Which means, for example, if somebody was going to a GP and saying, I'm stressed out today, the GP can only treat them for the symptoms they have. But we can offer other services, like if they were suffering from stress because they are in debt, or because they are having marital problems, or they don't have right housing, or they don't have employment. GPs can't do that. It's only the organizations like that, us, who has the depth of services, who can offer that. Interestingly for us, and just to let you know, that our communities developed this scheme a bit further and really scared the daylight out of me, because it engaged us all. They came up with this scheme. So it didn't only had the center, but it also had 61 homes for people with health problems to stay. Now that's a unique scheme in Bradford, which is like a health village. The total cost of it is about £10 million. It will take us 2-3 years to raise that kind of money from the funders. We will have to borrow money. But it can happen because you have the partners, you have the service providers, the community is working with you. So the lesson from that is that we need to work with our communities to deliver services which are fit for purpose. So when you're delivering services like that, you also got one eye on, I'll have to borrow the money to deliver these services. You've got second eye on that you're going to get the grants to reduce your liabilities. But the third thing is, how do you sustain yourself? How do you create the services which are longer term? You don't want to create programs which are time bound because it's grant funded. So we create schemes and programs which generate income. And income and surplus and profit is not a dirty word in social business. A lot of people have the view that we only work with volunteers and we don't have to pay real salaries. A big mistake. Our staff is more or less same qualified as you will find in any other health agencies. We invest heavily in them, and we pay them salary according to the market. Otherwise, we'll lose them again. So we created Inspired and Active Mind. What it is, it's a mental health service where people can have that service when they want it, how they want it, where they want it. But obviously, they have to pay for that. And we reinvest that money in the organization to provide the services in inner city areas. So, as a social business, we generate income from various programs, various assets we have, but we reinvest that money into the areas where people can't afford our services. Remember, I told you that difference between the Bradford Moor and Ilkley is 10 years life difference. That's a huge amount of difference within 6-mile radius. So our intervention, which is for free, usually goes in BD3. And if we have to charge people, we will go and do that in Ilkley. And you have to arrange programs like that. So to conclude, okay, don't go anywhere. So there is a number of lessons we had to take on board in our 7 years of journey. We as the system change, we need to acknowledge social businesses that they are here to stay. They can contribute to the services which is being offered within the health system. That they have the staff, they have the quality, they have the training to offer those services. And remember, the 10-year NHS plan has just come out. Some of that is part of that, which is very, very encouraging. So we will see more and more social businesses offering a lot more health programs at a community level. We can create partnerships, as we have done, working with statutory bodies and working with government departments to offer more local services, more fit-for-purpose services at a very cheaper cost. We don't have those overhead large organizations have, and we can respond quickly. And you need to work with the communities, because it is very difficult now, and financially very, very difficult to stack up in the old system where things were done to the communities. The communities have to take their own responsibility for their own health, which means they are part of the health system. They have the choice and the control of where they want health, how they want interventions. And there is nothing to stop, and the examples already exist that where health statutory bodies and social businesses are investing together and providing health interventions in a number of areas. And that will increase. We need to redefine the roles and the responsibilities and the accountability of the health workers. We need to see, if GPs are so busy, and it takes you 2 weeks to get an appointment, what is there they don't have to do and can be done with somebody else in the community, that we can release some of that time, some of that pressure, some of those costs at NHS. And also, obviously, it goes without saying, the technology is the key in health at the moment. It's going to play the major role in coming future. I've talked about services being fit for purpose. Now, I think I will finish on the last point, that the system at the moment is geared up where the money gets stuck at different places and it doesn't travel down. How many of you have heard about social prescribing? Hands up, please. Okay, quite a few. Social prescribing is where a GP can refer you to an organization like me. For instance, I provide diabetes prevention and management program. So a GP can refer you to us to provide that support. And we will be paid on hourly basis. But a GP refers somebody else for a welfare support, I don't get paid at all. Which means it's a drain on my resources. I'm a good guy. I'm prisoner of my social values, so I don't turn anybody away. But as a business, it's a difficult model to stack. So there needs to be a system where money travels with the service user. And in a NHS term, that is patient. So that everybody who's providing that can provide a sustainable service. So major lesson for me is money must follow the service user. Thank you for listening.